In this video, we'll talk about the glucose filtration curve and transport maximum. It means T max. We will talk about the glucose transport or glucose absorption. Uh, so we know that the normal glucose concentration is about uh, 150 milligram per deciliter. It's happened. How glucose absorbed in our PCT? There is sodium glucose co-transporter is present, and by the help of sodium glucose co-transporter, 100% glucose absorbed in the PCT. Uh, so let's talk about this. Uh, this is the curve. Uh, this x-axis and this is y-axis. On the x-axis, we should use plasma concentration, and on the y-axis filtered load of the glucose, filtered load of glucose. uh, it means glucose reabsorption. The plasma concentration of the glucose is about it means let's see here, this is 150, and this is 200, 250, and 300 and 350, and here this is the filtered load glucose. See here, filtered glucose, it is also one 150, and here 200, 250, and 300 and 350. So, we know that glucose molecule is freely permeable in glomerular capillaries and filtered in glomerular filtrate, and go to the PCT, and 100% of the absorption of the glucose molecule occur in the PCT. So when our glucose molecule is at the normal condition, it means 150 mmH, 150 milligram per deciliter. Then the reabsorption occur is also 150 milligram per deciliter. When it increase, uh, it uh, gives up, and about 250, uh, this line is straight, because the here the plasma concentration of glucose is 250 milligram per deciliter. So absorption of the glucose is also 250 milligram per deciliter. But when it plasma concentration of glucose become high from the 250, this curve is not straight, this is linear line is not straight. Here is some curve present. Why? Because this is the DCT of the nephron, and uh, some nephron have small DCT, so they have less sodium glucose co-transporter. So up to the 250, all the nephron will work and reabsorb the sodium molecule. But when plasma concentration of glucose increase from the 250, then some nephron will unable to uh, uh, absorb the glucose molecule. Some nephron reach to T max, their T max, not overall T max. So after 250, this curve is slightly down, and uh, some alteration, occur. And when this reach to 350, uh, it slightly down, not it go to the 350. When plasma concentration reach to 350, then all the nephron present in the kidney will reach to their T max, and no more reabsorption of the sodium occur, no reabsorption of the glucose occur. So this curve become like this. uh, if we talk about the filtration of glucose filtration occur mostly the linear equation like this. This is absorption, because as well as glucose concentration increase in plasma, more and more glucose filtered here. But reabsorption, how we define, up to the 250, the reabsorption is in a straight line. But after 250 milligram per deciliter, some nephron will not more reabsorb the glucose, so the hair is slightly curve present. And after 350, when this is reached to, see here, 350, this is 350, 350, this will be straight, no tiltation or no upgoing is present here. So because there is fully saturated, this is called the T max. So after the 350, there is no absorption occur in no more absorption occur of the glucose in PCT. Uh, this is a curve of the reabsorption and filtration. And see here, if we talk about the urine glucose concentration in urine, after plasma concentration 253, slightly urine present in our plasma or urine. And then after 350, it will become more like this.